Right now at 5:30, getting your questions answered about the pandemic and this latest surge. Good evening, I'm Dick Brennan.
And I'm Cindy Hsu. Welcome back. And as we continue to deal with the surge in cases, there is new information from the global fight against the pandemic that U.S. health officials are paying attention to. In Israel, experts are now recommending a new round of COVID booster shots for high-risk residents. That a fourth shot after data showed protection from an earlier booster started to wane.
South Africa has been at the forefront of the Omicron wave, and today they're reporting a drop in new daily cases, leading to speculation that the country has passed its peak. That has medical experts wondering if we'll see a similar timeline. And there is a lot of information and a whole lot of questions. So we invited a doctor to join us live right now.
And he is here now to answer your questions is Dr. David Goldberg, an infectious disease specialist at New York Presbyterian Medical Group, Westchester. He's also an assistant professor of medicine at Columbia University.
Dr. Goldberg, thank you for joining us, and let's get right into the questions. You know, we know the CDC estimates that more than 90% of cases in New York are associated with the Omicron variant. Arthur asks, how does the Omicron variant make up such a large percentage of cases if it just got here? Doctor.
Because it is highly, highly transmissible. We've never seen anything like this. We see the flu season every year. The number of cases gradually goes up. We've seen other outbreaks. We saw the initial outbreak of COVID a year and a half ago, and the number of cases increased slowly. The rate of transmission of this virus is breathtaking, and that's why it literally took over in just a matter of a few weeks.
Doctor, as we mentioned, there are reports of Israel giving out a fourth shot or second booster to some people. Another viewer asked, should the U.S. do the same?
I don't think we have enough data quite yet. Israel was ahead of the curve in recommending the booster shot. We have a lot of respect for the research they do there. I think it's a little too early. Right now, a fourth vaccine is recommended for severely immunocompromised people, meaning those who've had transplants, those who are getting chemotherapy for cancer. For most other people, I think we should wait and see right now. But recommendations could change overnight.
Yeah, you know, we reported that the Delta CEO is asking to cut the quarantine period for breakthrough cases, because as one viewer is asking why the quarantine period for Omicron could very much be different than the Delta.
Yes, there actually is good medical evidence that especially for vaccinated people, the duration of infectivity may be less. There's good information that 7 days may be adequate if you've been vaccinated. And I know they've changed it now in the United Kingdom. They're only asking people who've been vaccinated to quarantine for 7 days. I think that might change here. Literally, they could change the recommendation tomorrow. There are good data behind that.
Dr. Jessica from New Jersey asked about the forecast of the Omicron variant. Now that we're seeing reports out of South Africa that new case numbers have dropped.
We may very well see the same thing. The big problem, the issue with our country, of course, is we're such a large country. There's so much variation, and even as it starts to drop in the New York area, it may start to increase in other parts of the country, and maybe then it will be reintroduced into New York. So the speed of decline in South Africa is very encouraging, but we're a very different country, so we hope so, but we can't be sure.
You know, Doctor, we have seen the lines for testing all around New York City and the tri-state area. It's been absolutely terrible for people coming up on the holidays. Francesca asks, what if you get tested and it's negative, but you feel worse the following day? Should you get tested again? It's got to be very frustrating for people, Doctor.
I've had a number of patients tell me they initially tested negative, and then a few days later they tested positive. The first question is, what test did you get? There's two tests out there, the rapid test, also known as the antigen test, and there's the PCR test, which is considered the gold standard. The rapid test is really quite good, and it's acceptable in most situations. But if you really think you might have coronavirus, if you got symptoms and they're not getting better, then a rapid test may not be sufficient. And even if the rapid test is negative, you should probably go for a PCR.
Dr. Alexis asked, how long after having COVID do you have to wait to get a booster?
As soon as you're feeling better. Once the illness has resolved and your symptoms are almost all gone, then it's okay to get the booster. And I just want to say this now in case it doesn't come up later. It is so important for everyone to get the booster. One of the few points that everyone agrees on is that in order to be protected from this Omicron variant, you absolutely need the third shot. 2 shots are not enough. And I've seen too many people who rushed to get the vaccine at the beginning, got their first 2 shots, and haven't gotten the booster yet. We can't emphasize that enough.
All right, here's another one for you. It comes from Evan, and he talks about, we reported on long lines for testing and waiting to get results, and he says, if you can't get a COVID test for a few days, but you have the symptoms, should you self-isolate during the intervening period?
Yes, you really should.
That was easy, Doc. That was one. We like that. Very quick. Well, listen, Dr. David Goldberg, we really appreciate you being with us. And we have a lot of questions, and we hope you can come back and do it again sometime.
Thank you for inviting me.
Thank you.
Thank you. And there was a lot of good information there. So if you missed any part and want to see the full interview again, it'll be up on our website. That's at cbsnewyork.com.